iCRNA is an anesthesia case logbook designed specifically for nurse anesthetists. Why use iCRNA? At work, do you receive a report on how many cases you have done, a breakdown of the types of cases, your patient demographics, your blocks and procedures? Do you track your complications and outcomes? iCRNA provides you with an easy and efficient way of collecting this information. For years, practicing CRNAs have been collecting QI and QA information. However, this information is not always fed back to us. New methods of CRNA-driven data collection and feedback are necessary. iCRNA is downloadable from the iPhone App Store and is a part of a doctoral project in the trial period. You'll be asked to utilize the app for 60 days, and then we'll be asked to answer a survey on the usability and feasibility of iCRNA. You will not be asked to share any of your case information. The purpose of this is just to pilot the application. You open iCRNA like any other app, and it is encrypted and password protected. To enter a new patient, you choose New plus sign on the bottom left. Each form will have 3 sections: case data, patient data, and outcomes. Each tab will be highlighted blue for the current form that you're on and can be toggled between the 3 by just touching the tab at the top or the bottom of each page. We'll just quickly go through the form to show you how to enter data. The date and case number will be automatically populated. Rectangular boxes are for text entry, where oval buttons will pop up choices to populate your fields. For example, the rectangular box next to patient ID allows you to track your patients by name, medical record number, or any other method that you want to track your patients by. Oval buttons such as surgical setting will link to a pop-up list and allow you to choose from the pop-up list. Anesthesia provider model, same thing, choose from the pop-up list. Choices such as surgical type and anesthesia procedures can be typed in directly into the text box, or by hitting the oval button, surgery type, will link you to a database where you can search by scrolling through. You can search alphabetically on the side, or you can type in and search at the top for your procedure. By doing it this way, it will automatically populate the surgical service. Anesthesia procedures are logged the same way by pressing the oval button, bringing you to the lists, searching the same way, scrolling alphabetically, or entering in the text search box. These are separated by the name of the procedure, the approach, and the type of procedure that will automatically populate in the box for you. By hitting Enter Times button, you'll be taken to a second form which has all of the anesthesia times to record. You can record some or all. Hitting OK will take you back to the main screen. You can view your times that you already entered by hitting View Times and take you back to that form, and you can edit and return back to the main screen. Moving on to the second tab, you scroll to the top or bottom of the page and hit Patient Data, be highlighted blue. Same rectangular boxes and oval buttons with pop-up lists, or you can enter free text in the text box if you prefer. On the bottom of the form are customizable buttons. You hit the blank button, take you to a form. You can enter in whatever you want to follow, and it will become the default for that button. Hit the back button, take you back to the form, and you can now see that that allows you to have a text box to follow that, and you can enter the technique that you used. The photo button allows you to enter a photo from your photo library, or you can use your real-time camera, take an image of your technique or procedure, and use that, and that will be saved into the file for that patient. The last tab of the patient log is Outcomes, and separated into Complications and Quality Outcomes. The default will be set to no complications and no issues with quality. Complications is set up like other oval buttons and gives you a screen to scroll through and choose. The last button is Quality Outcomes, and this is a way to document the current indicators of quality anesthesia care. That completes the data entry portion. If you hit OK, you'll come back to the main iCRNA screen, which shows all of your previous logs. You can re-enter them to look at them, or you can horizontally scroll at the very top to just look at the different fields that you had entered. There's also the ability to run a quick report on specific fields, including surgical location, anesthesia model, method, patient gender, age, ASA, weight, height, and BMI. Horizontally scroll at the top over to the field that you want to run a report on, such as ASA. Hit the button, Run Report, and it will show you a breakdown of the different ASA categories you have done. You can do this for several different categories. A better way to analyze data is to export your files. You can do this simply by emailing it by hitting the Tool button. However, the best way to export your log is to go to the main screen and on the bottom right corner touch Connect button, which will open up a desktop connect function. Type this address into your desktop browser. The phone will connect and allow you to download your iCRNA log in a CSV file or comma-separated file. This is important because you can open this file in Excel and analyze, sort, and do all sorts of things with your data. If you would like to use iCRNA, please email icrnadatabase@gmail.com and I will provide you with the login access. Thank you.